of Disease Prevention's Mind the Gap webinar series. This series explores research design, measurement, intervention, data analysis, and other methods of interest to prevention science. Our goal is to engage the prevention research community in thought-provoking discussions to promote the use of the best available methods and to support the development of better methods. Before we begin, I have some housekeeping items. To submit questions during the webinar, there are two options. First, you may submit questions via WebEx by clicking on the question mark in the WebEx toolbar. Please direct your questions to all panelists. Second, you may participate by Twitter and submit questions using the hashtag #NIHMTG. At the conclusion of today's talk, we will open the floor to questions that have been submitted via WebEx and Twitter. Lastly, we would appreciate your feedback about today's webinar. Upon closing the WebEx meeting, you will be directed to a website to complete an evaluation. We would appreciate your feedback as it will help us improve this webinar series. At this time, I'd like to introduce Dr. David M. Murray, Associate Director for Prevention and Director of the Office of Disease Prevention.
Thank you, Marie. Today's speaker is Dr. Jamie Shariki. Dr. Shariki is Professor of Health Policy and Administration and Co-Director of the Health Policy Center in the Institute for Health Research and Policy at the University of Illinois at Chicago. She has more than 27 years experience conducting public health policy research, evaluation, and analysis. She's a national expert on evaluating laws and policies for communities, systems, and population health with an emphasis on chronic disease issues including obesity, substance abuse, and tobacco control. Her current research focuses on the implementation and impact of federal, state, and local obesity, nutrition, and physical activity-related laws and policies on communities, schools, and individual-level outcomes. It's my pleasure to welcome Dr. Shariki.
Thanks very much, David, and it's a pleasure to be here today. Just to start out, I have no financial disclosures or any other relationships to disclose for this presentation. So today I'm going to briefly review a couple of things. First, I'm going to talk about what do we mean when we're talking about measuring law and policy for use in evaluation, epidemiology, or implementation impact studies. This is something that I know many of us are doing these days, and we're looking at the impacts of population-level interventions such as public policies. But there's a lot of confusion in the field about how do you really go about measuring it scientifically so that you have a robust independent variable as well as your dependent outcomes. The second thing I'll talk about briefly are the importance of having conceptual matches between your policy measures and your outcome measures. I'll talk briefly about study design considerations when you're looking at the implementation impact of public policies on outcomes of interest. And then I'll also identify some considerations to think about when you're developing policy data sets, much like you would with other data sets or using existing data sets. So some of the research questions that you might think about in the obesity space and in the tobacco space might include, for example, what is the impact of a new complete streets policy on adult biking or walkability, for example? On the tobacco side, what might be the impact of tobacco minimum pricing laws on reducing smoking rates? So these are just examples of the types of research questions you might be interested in. You may be interested in looking at them in one jurisdiction locally where you are in a state or across the country and looking at variation in policies nationwide like I often do with my work. When I'm talking about policy, my work typically focuses on what I'll call the big P, public policy specifically, which are formal policies adopted and implemented by an official governing body, a government in other words. So at the federal level, it would be the federal government, executive branch agencies, Congress, things like that. The state level, it would be the state executive branch for regulations and the state legislature for legislative measures. And at the local level, there are a variety of different jurisdictions that would be of interest. You could have counties, you could have municipalities, and you could have school districts, which are often considered special governments. From a type of policy measure, we're really talking about a variety of different types of measures. There's legislative measures, which at the local level are considered ordinances. There's regulatory measures, there's court decisions, executive orders, And in the urban planning field, there's also plans, which are master and comprehensive plans or general growth plans, for example. But typically, the common element of all these measures is that they are developed and enacted by an official governing body. Okay, on the legislative side, it's an elected body. On the executive side, it's going to be an appointed entity. The executive branch will develop regulations, whereas legislative branches will develop legislation. I want to differentiate public policies from more informal policies, such as organizational policies that might be developed by a hospital, for example, or a healthcare system, or by a membership organization such as the YUSA or community-based organizations, things like that. Those are also policies, don't get me wrong. It's just when you're measuring, you just want to be clear in your definition of what you're including in policy. My work historically is always focused on studying the implementation and/or impact of actual public policies, but just be very clear when you're talking about policy, what type of policy you're talking about. There are also informal policies adopted by official governing bodies, such as memorandums of understanding, agreements such as shared or joint use agreements, contracts and things like that. Those might be considered in your definition of policy. You just need to be explicit about it. How do you go about collecting policy so that you can measure it for use in evaluation and implementation studies? Well, just like any other data collection approach, you can do it objectively or you can do it through some type of survey or self-report. I personally, just because of my background in public policy and political science, I tend to rely more on objective collection of policies, so collecting policies from the jurisdiction of interest, whether it's across the 50 states or school districts across the country or municipalities across the country. And what this involves is just doing primary legal research where you actually collect electronic or hard copies of all the policies that you're focused on. You could, if you're dealing with things at the state level or large jurisdictions, you could use commercial legal research service providers such as Westlaw or LexisNexis. Government websites are another option. I'll discuss the pros and cons of that in a second. But regardless of whether you're going to use Westlaw, Lexis, or a website, we typically will always do some type of verification with the jurisdiction of interest just to make sure that we have complete capture of what we're doing. I apologize for the typo there on my slide. Another option, of course, is crowdsourcing, which for some areas that might be your best available option at the moment if you're trying to, for example, quickly try and collect policies on a topic such as new urbanist zoning, which by design is more pedestrian-oriented by design, and you want to quickly get that information. You might reach out to colleagues at the American Planning Association, Smart Growth America, things like that, Form-Based Code Institute, and ask them to send out an email to all their listservs asking people to help crowdsource and maybe populate a Google map or something like that to identify jurisdictions that have adopted new urbanist zoning. That might be an example of crowdsourcing for policies. The downside to government websites, because I know that's the cheap and easy way to go, and for example, for NIH grants, it's certainly the most economical. The problem is that the official source of codified law enacted by a state, for example, or by a local government, or the federal government for that matter, is going to come from that government itself. Now, at the state level and at the local level, they work with a code publisher. So, for example, some states will work with LexisNexis to publish their formal code of their ordinances or their laws. Other jurisdictions will work with MtG and with Westlaw to publish theirs. So the official source of their actual codified law is going to come through one of those publishers. That will include legislation, statutory measures, as well as regulations or administrative law. Just like at the federal level, you have your U.S. code and you have your Code of Federal Regulations. The government websites are great, but they can't be relied upon as being the official source of law, and it actually has that caveat on all government legislative websites, for example. They also are not updated on a regular basis, and they may not be complete. So you just need to recognize the caveats of using websites to collect policy information versus using a formal code publisher. The caveat here is for something like school district policies, which some of you may know that I do a fair amount of research in that area, there is no code publisher for school district policies across the country, and so there you do actually have to rely on web-based material and complete verification follow-up with the school districts to make sure you're not missing anything. On the alternative side, you might want to do a survey of government officials to identify what they're reporting of policies that they may have in place. And just like any other survey, think of it like a large national survey like the National Health Interview Survey or the School Health Policies and Practices Survey, BRFIS, YRBS, things like that. Just like any other self-report survey, it's subject to the same limitations and biases of a self-report survey. And so my hypothesis is that those self-report surveys of government officials often will combine official policies on the books with what they're actually doing in practice. And they may actually overstate what they may have on the books. Maybe they're doing things more informally without formal policy. So just recognize that if you're using surveys for the source of your policy information. Now, there's an important distinction I want to make because people think that you could go to any source that's out there and get information to use in an NIH-funded study to look at the impact and implementation of a public policy. And so what I want to make a distinction between what I call policy tracking versus policy surveillance. So two examples of sources for policy tracking, there's the National Conference of State Legislatures, which is a great source on a whole host of topics in the health domain and health-related domain that basically tells you individual laws, that the current status of individual laws that have been enacted, that are introduced, vetoed, things like that, and a whole host of topics. Another example specifically in the obesity space is at the UConn Red Center for Food Policy and Obesity. They have a great legislative tracking system that helps you monitor individual bills introduced or enacted or vetoed at the state level across the country. Now, I want to distinguish policy tracking systems from policy surveillance systems. Here are a couple of examples of policy surveillance systems, 3 at the federal level and 1 that is a public site that's not federally sourced. So the first one is from CDC. It's the Office on Smoking and Health State Tracking and Tobacco Activities Evaluation System. The next one is from NIAAA, the National Institute on Alcohol Abuse and Alcoholism. It's the Alcohol Policy Information System. And at NCI, the National Cancer Institute's classification of laws associated with school students. These 3 systems that are sponsored by the federal government and they're compiled through contracts with government contractors, these are what I would consider to be large-scale policy surveillance systems. Just like any other surveillance system that's out there, like BRFIS or YRBS, it measures policy across the states in all 3 of these systems as of a certain point in time. So for example, for class from NCI, the standard effective date that's measured in that are laws in place as of December 31st of each year. The state system from CDC actually updates on a quarterly basis, and I apologize, I don't know the current updating about this. But they compile sort of the current status of law as of a certain point in time each year so that you can look at change over time across the full spectrum of laws in a given topic. Another source of policy surveillance data that's compiled by researchers across the country is the Law Atlas database, where people might upload their own policy surveillance data into the Law Atlas system. Now, here's an example of what the difference is between monitoring an individual bill, like through NCSL or the Red Center database, versus looking at codified laws in a policy surveillance system based on statutory text. For those of you who don't remember your American Government 101 class, individual bills will get compiled into statutes at the federal, state, or local level. And the statutes, basically think of it as like the encyclopedia or the volume that combines all the individual measures into one codified measure. So on the left here, you'll see individual bill text. This is in Section 4 that's updating an existing statutory section. It makes it look like the only requirement for graduation for a high school diploma is an online course requirement, this language highlighted here in green. However, this individual bill is actually amending a specific section of the state code, which you see over here in the statute. And there are actually 3 other sections that precede this Section 4 that's being amended in this individual bill. So if you just looked at bill and just did bill tracking, you would actually miss the whole story of what the actual graduation requirements are in this particular state. So in summary, some of the pros and cons of policy tracking versus surveillance systems are on this slide. So policy tracking systems are great if you want to follow individual measures without really caring about prior policy action or how an individual measure fits in the broader context of the codified law. It's also great if you want to look at pending legislation. A lot of advocacy organizations will monitor pending legislation, and that's great if you want to really sort of understand movement and traction on a particular topic. By all means, policy tracking systems have a great use for those types of activities. Policy tracking systems tend to be more text-based, sort of telling you whether a bill is under consideration or not on a specific topic, maybe a keyword. And they often tend to get updated on a much more frequent basis because the level of effort required to update them is a lot more simplistic than what you would do in a policy surveillance system. But as I mentioned before, it is really hard to measure sort of changes in policy over time with a tracking system. Whereas with a surveillance system, here you're really looking at changes in policy over time, as I mentioned, typically based on a specific reference date, just like any other disease surveillance system that you might use for your studies. The surveillance system can be quantitative or qualitative. I like to say that I quantify and measure law and policy for use in large-scale evaluation studies. So although I develop a large-scale system for evaluating the content of the law and policy based on the text of the law and policy, I develop numeric codes or quantifiable codes, ordinal codes, to often go along with the qualitative measures that I'm coding. And I'll show you an example of that in a minute. But what's important about surveillance systems is you can monitor change over time in the exact same measures just like you would do with any other surveillance system, as long as you're not actually changing your coding of the measures over time. So the thing you want to think about, and on this slide here, I actually illustrate 3 different approaches to coding laws and policies. So on the first row here, I'm going to look at a sugar sweetened beverage policy example, and the second one I'll look at a tobacco example. So in the first row, approach 1 is what I would consider to be a text-based system. It's basically just pulling out language from bills or from a measure to tell you what the content of that individual bill or measure is. So in this first case with the sugar sweetened beverages, it's looking at, it basically says that only 100% juice, water, skim or non-fat milk may be sold during the day except at the high school level, and it goes on from there. In the tobacco example, the language reads, smoking of tobacco products is restricted to employee break rooms that are separately ventilated and enclosed. As you can imagine, that was from my days in the 90s working in the tobacco arena. We don't advocate for those policies anymore, but just an example of text here. Approach 2 takes it more to a quantifiable example. It's asked whether or not there is a law that exists that governs the availability of sugar-sweetened beverages in school. So in this case, there is a law relative to it, so you might say yes, but you really can't say anything about what that law says or includes if you're just coding does the law exist or not relative to the availability of sugar-sweetened beverages in schools. Same thing with the tobacco one. Is there a law restricting smoking in public places? If you use, based on this language, you could say, yeah, a law exists, but you can't say anything about the content of that law. So this simple, does a law exist or not, based on a question like this, might be a nice simple way to tally things, but it doesn't tell you much about the nuances of the law. And this is where real policy measurement and surveillance come in, and this is where the coding schemes come in. So in the examples I provided from the state system, APIS, and CLASS, for example, and all those systems, they have these ordinal coding schemes really enabling you to measure the variability in the content of laws over time. So in the sugar-sweetened beverage example, a 0 would be no law, a 1 would be just restrictions are encouraged, a 2 might prohibit these beverages, sugar-sweetened beverages at certain times of the day or certain locations, and a 3 might ban all sugar-sweetened beverages in schools at all times. In the tobacco example, it might be no law, 0. 1 might be restricting it to designated smoking areas. A 2 might be to what the language is here, which is separately ventilated, separately enclosed areas. A higher level of restriction might be a ban on smoking in public places, except for employee break rooms. We used to see that quite a bit, like in restaurant language. And then a 4 might be an outright ban altogether on smoking in public places. So as you can see from this column 3 here, or approach 3, the language varies quite greatly, and how you code it really can make a huge difference in your interpretation of the impact or implementation of laws and policies on your outcomes. And then just to illustrate for you, just like any other data collection process or tool, I and my team, we develop actual coding tools just like you would for a survey or any other data collection approach. And we actually have detailed protocols that guide how do you go about coding and measuring the content and laws and policies. This is actually from a local zoning project that I did from an NIH grant that I had a couple of years ago. And then these are just a couple of examples of papers from the class system from NCI, where we develop systems for measuring sort of the comprehensiveness and strength of laws and policies across the 50 states in the District of Columbia in the areas related to physical education, as well as the school-based nutrition policy environment. These papers are available in the reference list that I have at the end of the slides, and they're just 2 examples. I apologize for the ambulance. I work in a medical district. So here's an example illustrating why does it matter if we use sort of a simple approach of does the law exist or not versus a detailed coding scheme looking at sort of the variation in the content of law. So this is from a paper that my colleague Dan Tabor and I and our colleagues Lisa Powell and Frank Chalupka published in the Archives of Pediatric and Adolescent Medicine back in 2012. Here we looked at whether or not there was a difference in student access to sugar-sweetened beverages, purchasing of sugar-sweetened beverages, and consumption of sugar-sweetened beverages based on policy content across the 50 states. What we basically found is that policies that only ban soda, so this middle color here, policies that only ban soda really were no different in terms of the amount of access students had to sugar-sweetened beverages than policies that simply allowed all sugar-sweetened beverages. If you're going to ban soda, kids will substitute to other beverages. Whereas policies that specifically ban all sugar-sweetened beverages beyond just soda, including your sports drinks or sweetened teas, things like that, there's significantly less access to those beverages in schools in those states that banned all sugar-sweetened beverages. We saw a similar thing with purchasing. Consumption here was based on overall consumption in and out of school, and as we all know, schools can't do this alone, and there are a variety of other places where kids are gaining access to sugar-sweetened beverages. But the point I want to make with this slide is banning all SSBs is very different than policies that simply ban soda. So that nuance is really important when you think back to the coding examples I provided a little bit ago. And similarly here, this is another table from a different paper that Dan Tabor and I did, where we basically showed the substitution that's going on. If a state law only bans soda, then high schools still sell other sugar-sweetened beverages to kids, and the relative risk of kids purchasing them is significantly higher. Let me jump to a tobacco example for a minute. We had a UL1 grant from NCI where we were looking at a variety of different tobacco taxation and pricing laws and policies and studying their implementation and impact on tobacco use and consumption and purchasing. These are 3 monographs actually we published. They're all available on tobacconomics.org. But one of them was on tribal tobacco policies, one was on tobacco product taxation, and one was on tobacco product pricing. These were based on surveillance data looking at laws and policies as of a specific point in time. Let's just take a look at what happens if we don't really focus on the nuances and the details of laws and policies in the minimum markup tobacco area. So this is just sort of an example for you of the structure of tobacco product pricing. It's very complicated for how states might define minimum markup. You have your base cost, then you have a wholesale or statutory markup, a minimum price, and then retailer statutory minimum price. So lots of components can go into how states might define minimum markup. When you look at the variation in the factors that might increase that base cost of cigarettes, and remember the base cost is this table up here, so it can include the manufacturer list price, taxes, cartridges, trade discounts, and other costs and fees. If you look at the variation in the number of states that address all those different things, it varies greatly. So if we just said, does the state have a law governing base cost? Here you could actually say, yeah, 31 states have a law governing base cost, but there's tremendous variation in how they're defining the base cost of cigarettes. And if you don't look at that nuance in the definition of the base cost of cigarettes in the state law, you wouldn't actually understand how those 31 states' laws varies for your analysis. Here's another example. This is also from that minimum pricing chart book that we issued. This heat map, which is here on your right-hand side of the screen, illustrates how much variation there are across the states on factors that might increase or decrease the base cost of cigarettes. This was across all 50 states in the District of Columbia, and actually it was the 31 states with minimum pricing laws. As you can see from the heat map, there's a wide range of the number of factors from the state laws that might increase the base cost, and an equally wide range of a number of factors that might decrease the base cost of cigarettes. So if you actually just said, does the state law govern the base cost of cigarettes, yes or no, you're not going to be able to tell anything about the nuances of it. And if you try to link, does the state law govern the base cost of cigarettes or not, with your purchasing and your outcomes, you're going to not really see much variation whatsoever. What really is going to matter are these nuances and variations in how the base cost is defined. So hopefully I've actually illustrated for you how important it is to really understand the content of the laws and policies for use in your evaluation studies. Let me just briefly touch upon another concept that I hit upon in the NIH Pathways to Prevention workshop in National Experiments in Obesity Prevention back in December, which I believe is available online for viewing as well. There I talked about the need to ensure a conceptual match between your policy, your exposures, and your outcomes. So think of it very simplistically. You want to have apples to apples in what you're measuring in terms of your policy measure and what you're measuring in terms of your outcome measures. So for example, if I'm measuring laws and policies, actually I'll go to my next slide for my examples here. So for example, in my zoning grant that I mentioned that I have from the National Cancer Institute, there we coded for zoning provisions for a variety of different built environment features that are known to facilitate walkability and physical activity. So passive recreation would be like your green spaces and your open areas. Bike lanes is another measure we looked at, so in these first two examples here. So if we wanted to look at the relationship between zoning for passive recreation and physical activity outcomes, we wouldn't necessarily want to link zoning for passive recreation with the rates of active travel to work, because passive recreation is getting at greenways and open spaces. Those are not that's not the infrastructure most likely to be associated with active travel to work. Whereas jurisdictions that zone specifically for green space and open space we hypothesized, and we did find in multivariate regressions, that they are associated with reduced rates of adult inactivity. So you have more of an apples to apples match here. We could do the same on the inverse in terms of increased rates of adult activity, leisure time, physical activity. On the bike lane measure, we wouldn't want to link zoning for bike lanes, for example, with zonings for measures of playgrounds on the ground, because bike lanes are not going to likely lead to an increase in the amount of playgrounds on the ground. Instead, we would want to be able to link zoning for bike lanes with actual on-the-ground measures. GSV here means Google Street View aerial photos that we had compiled under a CDC Physical Activity Policy Research Network grant. So here we link zoning for bike lanes with Google Street View aerial photo data on the provision of bike lanes in the jurisdictions, and did find, in fact, that if you zone for it, you'll be more likely to see bike lanes on the ground as you would expect. And I could go on and on. On the school wellness policy side, if you're looking at policy provisions governing calories and a la carte snack foods, you don't necessarily want to link a calorie provision to requirements for total fats. You want to link policy data relative to calories to purchasing standards governing calories, or the amount of calories that are on the products that are being sold in the school setting. So this is what I mean by a conceptual match. There's actually a really good paper in the reference list from Ding that actually is a built environment paper, but really gets at this issue of conceptual matches. And it's not specific to policy, but I think it's a really important point to think about when you're linking policy to environmental measures and outcome measures. So now I briefly want to move over to thinking about examples of study designs that are often being used when studying natural experiments. You know, having served on study section for a number of years, and I often would get assigned a lot of the policy grants to review, these are some of the most common designs that I typically would see and what you're seeing addressed in the literature quite a bit. And there's a great reference in the reference list at the end of the presentation from Alex Wagner and Kelly Cromo. It's a book chapter that really talks about study designs for use in natural experiments that I would point you to. But some of the standard ones, of course, would be pre-post with comparison jurisdictions. It really is going to help to have more jurisdictions in that type of analysis, so you can really assess whether something that's happening in one jurisdiction is consistently happening across jurisdictions. The second type of example would be a time series design, and that's great, but you often may not have a comparison to compare against. So having longitudinal change over time is great, but it's ideal to have some type of comparison, and that's where some of the difference and regression discontinuity designs come in. What's really important to think about is that you need to ensure, and this is really hard to do because you need to design your studies well enough so that you'll have your outcome measures pre or prior to your policy measures, so that you have things measured before and after the policy change, so that just like any other intervention, so that you can really assess what the effect is of the policy change on your outcome of interest, whether it's environmental measures or individual level behavior changes. Alex Wagner and Kelly Cromo cite that some of the key criterion for comparison sites when you're doing a pre-post study is that all causes of the outcome variable are similar across two sites. So often when researchers generally are drawing comparison communities, they usually will do it based on sociodemographics, which are key, obviously, for influencing outcomes. But there are some other factors that you often might need to consider when you're looking at policies as your instrument, besides just sociodemographics. So for example, in the food policy space, you want to look at communities that have similar food environments pre the policy change, so that you're really looking at comparable changes that might happen following policy change in the community food environment. Some other design considerations besides the type of study design that you might use are really important to think about with law and policy. One of the biggest challenges that we face as researchers is you often need to make sure that you have enough of a lag to allow for implementation. Some policy changes take effect almost immediately. So typically, like a tobacco tax change will take effect on a standard date, either July 1 or January 1 of a given year. And you can pretty much guarantee that that tax administration will take effect on that date. Other changes, like zoning changes, will take time to implement over time. And so you need to make sure that you allow time for that policy change to be implemented before you can really measure the impact of that policy on the outcomes of interest. You also need to understand, as I just mentioned, the effective date of the policy change. This is so important for your policy surveillance studies. You really need to work with researchers who really understand how to analyze laws and policies so that you have a comparable measure of laws and policies as of a specific point in time in a surveillance data set. So like in the NCI class system, as I mentioned, our effective date there is December 31st of each year. So we analyze all state laws and policies across the country for class to look for those policy provisions that were effective as of December 31st of each calendar year. You want to think about whether your outcomes likely are going to vary over time. If they're not going to vary over time, then you may not need to measure change every year. You might be able to do it more infrequently. And then you need to make sure that you have a consistent measurement of your outcomes over time at the same point in time as well. So in one of the areas I do work in the obesity area, looking at beverage purchasing, we know that beverage purchasing is quite seasonal. In the summertime, people might hydrate, get more dehydrated and drink more than they might in the wintertime, or the nature of the beverages they purchase in the summertime may be very different than what they purchase in the wintertime. So you need to account for that with your outcome measurement if that's an issue of concern. And lastly, let me just talk about a couple of data considerations to think about and really understand, particularly if you're going to be relying on someone else's data for the measures of policy, whether it's an advocacy organization that's compiled the measures, whether it's one of the systems I mentioned, whether it's something that's compiled by another researcher and you're going to use it. The first very important question you need to think about is, why was the data set developed in the first place? What was the purpose? If it's coming from an advocacy organization, it was for advocacy purposes. And so it wasn't done with research in mind, and therefore it may not have a lot of the components that I mentioned. It may not have a standard effective date. It may be rolling. The data may be updated almost daily, and you really can't change as of a certain point in time over time. So you need to really understand, why was the data set developed and who was the funder behind it. You need to think about the variation in the analysis of the policy content, as I mentioned earlier, where I showed you those examples of approach 1, 2, and 3. And also, how are the data being reported out? You want to think about, as I mentioned early on in this presentation, the sources of policy information. Was it compiled through primary research, such as I do with Westlaw and Lexis, or is it compiled through survey-based measures of government officials? That's really could have a very big difference in the prevalence of your policies that you're identifying or reporting for your analysis. You want to really think about the level of the expertise or experience of the people who are doing the policy research if you're doing the objective research. There are certain things that are great to involve graduate students in, but I have to tell you, over the years, I've hired so many law students to work with me on this work. They're not trained to do this typically in law school, although Scott Burris and CDC and Maris Ash and others are really developing the field of legal epidemiology, and I know there's more trainings going on in this area over across the country, but it's not uniformly integrated into law schools across the country. So don't just assume somebody has a law degree or they're a law student, they'll know how to do this work. This is a science and an art just like any other science that we might perform as NIH researchers. And so you really want to either learn how to do it properly or work with others who know how to do this from a scientific perspective. And then you need to think about the resources that you have available for the type of work that you do. Depending on the detail and the scope of the policy surveillance system you might want to set up or use, the resources that will be required will vary quite greatly. As I said, you can use free sources such as government websites, but the comprehensiveness and validity and reliability of your data may not be as robust as what you might have from objective work. However, it's going to cost you more to do the objective work. So you need to weigh the pros and cons of that. And at a minimum, in your grant applications and in your research papers, you need to acknowledge these limitations. You need to be upfront, just like you would, NIH has, we need to promote rigor and transparency in all of our work. You need to do the same here with legal and policy research when you're using it for study design and studying the impact and implementation of policies. Be upfront, be transparent about the limitations of the policy data that you're using. Some of the challenges with measuring policy and on-the-ground outcomes, so environmental measures, for example. So beyond the complexity of how you're going to go about measuring it and what to measure, that's complex enough. I encourage people to start simple Before delving into what my friend and colleague Marlene Schwartz at the Red Center likes to say, I tend to take small measures of policy systems and explode them infinitesimally into hundreds of variables. It takes a lot of work to do that. So be straightforward and focus on the measures of policy that are really going to matter for your study, your hypotheses, and the outcomes that you're going to be able to match to. Think back to that conceptual match issue I mentioned earlier. Just like any other data collection approach or measurement approach, you need to think about content validity, intercoder and rater reliability and validity issues. You need to think about, if you're going to develop scales or indices of policy measures, you need to think about the psychometrics associated with them just like you would with any other index or scale development. And then you need to make sure you have comparability, particularly in your outcome measures over time, so you can look at meaningful change over time. And then just to wrap up here, and then I'll open it up for questions, a couple of other really important things, and I can't stress this enough. This is my plea to any of you federal agencies on there who are listening in today or might listen to this video recording afterwards. One of the biggest challenges that those of us who do this type of work do, particularly when we're studying laws and policies across the country and we want to be able to link it with large national data sets, is very limited availability of Geo Codes in these large national data sets, in the public use files certainly, even sometimes in the restricted use files. So depending on the type of policy, certain Geo Codes are not helpful. So for example, with my zoning study that I have funded from NCI, I want to link the zoning data to adult leisure time activity data from BRFIS. The lowest Geo Code that I was able to get in the public use files at the time that I did this was county level. And even now in the restricted use files, pretty much it's a county level Geo Code in the restricted use files. That's great for some studies, and you can certainly, and I had to do this for this study, you can certainly create population-weighted county aggregated measures of municipal level zoning, but it's not precise. It doesn't actually tell you what the municipal zoning is for active living in each municipality within a given county, so you can't then look at municipal level zoning's impact on adult physical activity within a municipality. So the more that we can have in restricted use files access to lower level Geo Codes below the state and the county level, it's so important for being able to show the impact of these types of policies on our environments, on our communities, on our schools, and on individual level behaviors, but we're unfortunately restricted to what's available in these large national data sets. So just something to think about going forward. If you're doing a study just within your state or just within your community, this is not as much of an issue for you, but it is an issue if you're doing it on a national scale like I often do. And then finally, just a few other, 4 other considerations for you. As I hopefully have stressed for you, I can't employ you enough that if you're going to use policy data as your key independent variable or studying the impact of policy or implementation of policy, you want to make sure that you've measured policy correctly. You want to make sure that you've compiled it correctly, that you recognize the limitations of how to go about doing it, how to do it, the limitations of the data sources you might rely on for your policy data. One thing you want to know, and I only know this from my years of doing this work, I've been doing this work since about 1997, is that historical policies are often really hard to gather, even with Westlaw and Lexis. You can consistently get statutes and regulations for all 50 states in the District of Columbia dating back to the late 90s, early 2000s, but regulations in particular are really hard to come by for all 50 states and DC prior to that time. So just something to consider when you're designing your studies. But that really does require nuanced understanding of the law and how law is compiled. And you'll have the same problem. I will tell you, it's really hard historically to go back and get local laws, school district policies, local codes, things like that, because most of the publishers don't publish annual volumes like Westlaw and Lexis do for the state level, for example. you want to think about issues of exposure, and this is one of the biggest challenges I often face from reviewer comments, both at my grants and in my publications. You know, how do we know whether people are actually exposed to the law and policy? And this is where having the lower level Geo Codes for linking to your policy is really key. Doing smaller scale studies within a community or within a state, it's a lot easier to be able to sort of hone in on you know, whether people are spending all their time in a community where the policy exists versus not. It's harder to account for this in the larger scale studies I mentioned, and unfortunately it is a limitation we face. Indigeneity is definitely an issue. It's something you really need to think about. There's actually a really good urban planning literature out there on indigeneity and policy, and also in the economics fields as well. Having more longitudinal data on exposures, outcomes, and individuals really helps to be able to tell whether changes are due to the policy or not. But you do need to think about issues of self-selection, like in my zoning study. How do you know what came first, the chicken or the egg, the zoning or the people? Did the people move there because it's more actively friendly, or did they move there after the zoning changes took effect because it became a more actively friendly community? And then finally, as I mentioned earlier, you need to allow for time lags for policies to be implemented and time for them to have any impact on the outcomes of interest. So when you download the presentation, you'll see I have several slides of references. If any of you are on the call who are on these references, thank you very much for your great work. And with that, David and Marie, I am happy to take any questions.
Thanks very much, Jamie. Great presentation.
Thank you.
I was thinking about the kinds of issues that you might cover, and you've touched on just virtually everything that I think needed to be touched on. I wanted to offer a few comments and ask some questions and relay questions from our audience. So you made a big point about being very thorough in the assessment of the independent variable, the policy or the law. And I think that's terribly important. You've made it clear it's not enough just to know that there is one or there isn't one. You really have to look at the nuances. And you talked about the difference between a bill and a statute, maybe not so much about regulations. There are also regulations that affect how a statute gets implemented. And I think you would say it's really important to know how the policy or that law is actually implemented in the community and not just what it says in the statute. Any comment on that?
Yeah, absolutely. So thanks for honing in on the regulation piece. I'll address both of those comments. So I briefly, sort of ran through about statutes and regulations. Depending on the topic area, regulations are incredibly important. And so, for example, for tobacco, for certain topics, for taxes, it's heavily a statutory-based issue. But for minimum pricing, regulations are critical. Likewise, in the school nutrition and physical activity areas, the statutes, much like laws in Congress, they provide the frameworks, or they provide the scope and the shell of what the law should focus on, but the details of how things should be implemented in practice are coming through the regulations. So you really want to understand your content area that you're focusing on for your study to know when and whether you should be focusing on statutory law, so legislative measures, versus regulatory law or administrative law, or both. For a lot of my topics increasingly, we're having to focus on both. So that's another resource issue, but it's also critical for comprehensiveness and completeness. And then, David, sorry, I forgot the second part of your comment or question. Oh, for implementation and really being able to assess implementation. So as you noted, and again, this is sort of like from your high school American Government 101 courses, if you took one, typically legislation is implemented through regulations, and that's really where the details come in. So, be mindful of that when you're studying implementation.
Let me ask a design-related question. There are lots of different designs that could be used to evaluate policy. You could look before and after in a single community or a single company or a single county or something. And if you have enough data, maybe you can use time series. Otherwise, it's a simple pre-post. You're just looking at change within, and you have no comparison site. And I think you'd agree that that's probably the weakest situation. At the other end of the continuum, you've got several aggregates, whatever they are, that have implemented this kind of policy, and a number of others that haven't. So you've got several versus several, and you can use mixed models or a variety of analytic methods, because you can look both at variation between these units and as well as within the units, and change between versus change within. There are some in-between things. What's your advice to people about the kind of design that they ought to try to get to? Would you advocate for this several versus several, or are there other things that you would suggest? What should people be aspiring to?
Great question. So first of all, I'm not a statistician. As you could probably tell from this talk, I'm a policy wonk. So first of all, I would strongly recommend that you work with a really great statistician. I've been fortunate enough to do that over time, to really hone in on the most appropriate design for your study. But in terms of aspiration, of course, you know, the more units that you have for comparison purposes, I think we're going to have more confidence in the findings. And so like in that Wagner and Comro chapter, they really talk about sort of, you know, just doing a pre-post within one jurisdiction is great, and that might be a nice pilot study or starting point, but it doesn't give us enough confidence that that one pre-post analysis in one community is enough to say that this type of policy change is going to make a huge difference or not, or any difference for that matter. So the more you can have, you know, maybe resources I know are really challenging for all of us, whether it's coming from NIH funding or foundation funding or even local funding. So I would say go with the most robust design that you can, given the available resources and given the time period that you have to work with. You know, some of these policies, you have to remember, will take longer to implement, and so therefore you need a longer lag, and so you might have more of an ability to compile some of the measures over time than you might in a shorter term turnaround. But whatever your resources will support in terms of the most robust design that allows for more comparison across jurisdictions, I think would be very beneficial and very helpful for advancing the field in your area.
I certainly agree with that recommendation. You spoke a little bit about selecting comparison sites, and the whole phrase it makes clear that we're not randomizing here. We usually don't get to randomize areas to receive a law or a policy. So we're usually talking about non-randomized studies. And to the extent that you have multiple jurisdictions that are implementing a policy, you're trying to find other multiple jurisdictions that aren't, that can serve as comparisons. You noted that matching or aligning these communities just on SES isn't enough, and I suppose what you're suggesting is that people should measure variables that are likely to affect the outcomes of interest, and then try to align or select a group of jurisdictions that are similar in those kinds of variables, and then you can have your policy versus no policy and have greater confidence. Did I get that right?
Exactly. That's exactly right. Thank you for more eloquently explaining what I was trying to say.
Are there methods you would suggest to people for how they would judge which ones are similar enough?
So depending on what you're dealing with, like if you're dealing, like here in Chicago, for example, if I wanted to look at some Chicago Public Schools is divided into 13 geographic networks. Think of each one as a separate sub-district, for example, school, almost like a smaller school district. And let's say we wanted to compare two networks. One network, we were going to introduce a network-level policy change, and we wanted to compare the impact of that policy change on student test scores and health outcomes and things like that, we want to find another network to compare against that's comparable not just in terms of the SDS and demographics, as I mentioned earlier, but also they look similar in terms of sort of their educational outcomes currently as well as their health outcomes currently, so that we are comparing apples to apples when we start, so that hopefully, the comparison network will probably stay flat. Hopefully it won't get worse, but hopefully it'll stay flat. Whereas in the intervention network that might introduce the policy change, they might see improvements in the educational outcomes or the health outcomes as a result of the policy change in the network of interest.
We have a question from one of our viewers asking about whether you have investigated the effects of policy or statutory changes on equity issues. So are some populations being disadvantaged by a policy change while other populations are being advantaged? Does that change over time? Have you done any work in that kind of topic?
Fantastic question. Obviously highly salient in today's climate, and a lot of us are focusing in on these equity issues now. To my knowledge, there hasn't been a lot of work in this space. I haven't personally done studies specifically focusing on equity. It's an area we are starting to move more into. Historically, we've always looked at variations in the implementation or impact of policies on various populations, but that's not getting at the equity issue. And so I think we need to do more work in this space, and I almost feel like it's a really good opportunity for a collaborative working group or something of people interested. I'd be interested, if anyone's interested, in forming some type of working group to figure out how do we best go about studying this, because I think it's a unique situation in and of its own right. Of course, you have to think about the fact that policies often will have unintended consequences, and I think that's different than the question that the person on the call is asking about, the impact on equity or inequities.
Yeah, I know NIMHD here at NIH is certainly interested in supporting more work to evaluate interventions designed to address inequities.
Yeah.
And some of those interventions might very well be policy or system level or environmental interventions, the kinds of things that you've been evaluating. So,
yeah, one thing I did do a year or so ago through some funding from the Robert Wood Johnson Foundation is we actually evaluate the content of complete streets policies across the country in terms of the provisions that specifically relate to equity. And we developed a whole inventory of equity-related language in complete streets policies and developed sort of a best practices report to illustrate how equity language was incorporated to those policies. But I haven't done it from a research perspective in terms of studying what the impact of that type of language is on outcomes of interest. That was more of a policy content analysis and a qualitative study where we actually spoke to folks to understand why and how the equity language got into the complete streets policies.
Thank you. Our time, unfortunately, is running out. I want to mention two items before I turn it back over to Marie to close up. Certainly, I want to thank you, Jamie, for a terrific job, and Marie will explain how people can access the materials and the slides and everything. I just wanted to mention, you noted regression discontinuity designs as one of the study designs that might be useful in evaluating these kinds of interventions. We're going to have a Mind the Gap webinar on regression discontinuity designs. I believe it's coming up in September with Jacob Bohr as the presenter. The other thing I wanted to mention is that often when you're doing these kinds of studies, it's a bunch of communities versus another bunch of communities, or a group of work sites versus another group of work sites. And methods that are used in group or cluster randomized trials can be helpful. And I've just mentioned the NIH website resources for researchers that may be of help to people who are considering those kinds of approaches. And let me now turn it back to Marie to wrap things up.
Thank you, Dr. Murray, and thank you to everyone who participated in today's webinar. On the Mind the Gap website, prevention.nih.gov/mindthegap, you will find several resources for this talk, including the slides and a list of references. We will also be posting a recording of today's webinar on our website next week. You will receive an email with the link to the recording when it's available. Thank you.